Welcome to the Boom Trust podcast, where we discuss important topics about neurodevelopmental disorders, which include but are not limited to cerebral palsy, autism spectrum disorder, ADD, ADHD, intellectual disability, among others. Beauty out of Mire. Our aim is to enable every individual living with neurodevelopmental disorders to live to their maximum potential and lead fulfilling lives. I am your host, Dr. Fidel Ada Baraza. Today we are looking at the important topic of understanding neurodevelopmental disorders. Neurodevelopmental disorders refer to conditions that emanate from injuries on the developing brain and the central nervous system, and at times injury on both the brain and or the central nervous system. So it's either or and both of them being injured. And these conditions begin very early from infancy, or at times even prior to infancy stage, and could persist all through a person's lifespan. And so they go on throughout life for an individual. Now, these disorders can impact the cognitive, the social, and emotional development of an individual, and often leading to significant challenges in daily functioning and quality of life of the affected person. And that is why it's very important and significant for us to be able to understand neurodevelopmental disorders, and especially in the continent of Africa, because at times we are not aware about these conditions, and then we end up not giving a person the necessary accommodations, support that they need, and even acceptance in the society as a whole. And that is the reason why today on Beauty Out of Mire, we want to be able to speak into understanding these conditions. Now, examples of neurodevelopmental disorders are diverse and encompassing a wide range of conditions. We have a condition like attention deficit hyperactivity disorder or attention deficit disorder, ADD and ADHD. This particular condition is characterized by inattention, hyperactivity, and impulsivity. And you'll find that a child is exhibiting these characteristics or mannerisms. But because we do not understand the condition, we do not understand the child either, we tend to think that the child is being ill-mannered and less behaved, like compared to their peers and the like. And this will then lead to difficulties in school, social relationships, and daily functioning. But we want to let you know that this condition exists, and this condition is clinical in nature. And interventions include medications, behavioral therapy, and educational support. And so if you have a child that has been diagnosed with ADD, ADHD, you know that there are interventions available for them. Another example of neurodevelopmental disorders that we want to highlight is Autism Spectrum Disorder, also known as ASD. Now, ASD is characterized by persistent deficits in social communication and repetitive patterns of behavior, and at times even restrictive and repetitive patterns of behavior. And it can end up also affecting a person's communication, so that they have deficits or they display deficits in social communication and interaction. And this affects their challenge and causes them to have challenges in social interactions, communication, and often sensitivity to sensory input. Some of them actually end up even displaying a sensory disorder, so that very high and loud noises would affect them. and they're not able to keep up with noises in the surroundings and the like. Interventions will include early intervention, behavior therapy, educational programs tailored to the individual's needs and support for families and the like. Now, even as we discuss this, it's good to know that as we go along for every kind of disorder that we mention, or I mention, it's good to know, for you to know that it affects a person on individual basis. And so we have others who are mild, mildly affected by the condition, others who will be moderately affected by the condition, but there are others who will go to the extreme, and so they are severely affected by the condition. And this is displayed across all these, disorders that I'm mentioning. The third example of neurodevelopmental disorder to highlight is intellectual disability, ID. And this is characterized by significantly below average intellectual functioning and limitations in adaptive behavior. And it will then lead to challenges in self-care, social skills, and academic skills for the individual, for the child or the youth who is affected by this condition. Now, we have again interventions available for the same, and these interventions will include special education, adaptive skills training, and even support services for the persons that are intellectually, disabled in one way or another. We also have the specific learning disorders, which is also an example of neurodevelopmental disorders. Now, specific learning disorders, because there are a number of them, we have examples of specific learning disorders will include something like dyslexia. Dyslexia would be challenges in reading. If a child has challenges in reading, it's not because they are daft and they are not able to read, however much the teacher tries to teach them how to read. It's because they have a disability, which is a neurodevelopmental disorder, and that is causing them to have a disability in reading. And so whether they are a child, youth, adult, they have that particular condition. And at times you might find that persons laugh at them. They try to read, and because they are not able to keep up with them, their classmates will be laughing at them. And at times the teachers will be punishing them because of the fact that they are struggling to read, not knowing that this child has a medical condition that makes it difficult for them to be able to read, and the condition is dyslexia. Another specific learning disability would be dysphagia. Now, dysphagia is the opposite of dyslexia. Dysphagia is difficulty in writing. So we have children who have dyslexia, they have difficulty in reading. But we have children who have dysphagia, they have difficulty in writing. They can be able to read, but now they struggle in writing. They are not able to write the same things they are reading. If you tell them to write, they will have everything else mixed up. And again, just like their counterparts who are dyslexic, you might find that their peers or the teachers are punishing them for a medical disability condition that they have. And that's why it's good for us to highlight and say, hey, they are children who have these medical conditions, and so as a caregiver, as their peer, and as their teacher, you need to be aware of such conditions, and so that you do not punish a child because of having a particular clinical condition. We also have another example of specific learning disability will be dyscalculia, and that is difficulty in mathematics. They're just people, they have difficulty in mathematics, learning up those, mathematical formulas and theories and addition of numbers. It's hard they are not able to do that. And however much you try to teach them. Now, it doesn't mean that every person who struggles with that have, a clinical disability, but there are others, basically, it is as a result of that. Now, what does specific learning disability, do? Now, these conditions challenge, end up challenging the person, and so the individual, the child, the youth struggles in academic achievement despite having average, or above average intelligence. Persons with specific learning disabilities, they are above, some of them have above average intellect. They are average or above average intellect. And so they are okay in every normal sense. It's just that they have a difficulty in that specific, area, so to speak. And interventions will include specialized teaching methods for the person, assistive technology. For the ones who are not able to read, they can have we have technological tools and devices that can read for them and make life easier, so they don't have to be exposed to this area of reading. So, we can have assistive devices, accommodations to read for them. Or for the others, it's assistive devices to help them in writing, taking notes and all that. And, and even for the ones who have dyscalculia, to be assisted in calculations and the like. And so we have those assistive devices, and we can also have things like accommodations in educational settings to accommodate children and youth who are struggling with those areas. We also have another example of neurodevelopmental disorders. We have the Tourette syndrome, and Tourette syndrome is characterized by repetitive movements or vocal sounds that are, impulsive, so to speak. They are involuntary movements, involuntary repetitive movements. And for this particular condition, you'll find that they impact a person's social and emotional distress. Although many individuals learn to manage their symptoms effectively as they go on, they learn to manage their conditions effectively and be able to work on that and go on. And not all of them are able to do that and the like. Now, interventions will include medications, behavioral therapy, and counseling. We also have cerebral palsy, and cerebral palsy is characterized by a group of motor disorders that affect the body movement, the muscle tone, and the posture. And as we do, about that, it's good to know that these challenges will impact the mobility of the person, the communication, and daily activities. And these daily activities, every person needs to be able to have the daily activities in place to be able to learn. And so we have interventions. Interventions will include physiotherapy, occupational therapy, speech therapy, assistive devices, and the like that we need to have, available for individuals with cerebral palsy. We also have the Rett syndrome. Now, the Rett syndrome primarily affects female persons and is characterized by delayed development, loss of motor skills, and hand movements. And so you'll find Rett syndrome mostly in the girl children, and the youths, female youths and the like. And this, in a way, moves from severe intellectual disability, problems with mobility and communication, And so a child will exhibit these kind of things, intellectual disability, severe for that matter, problems with mobility and communication. And the interventions include comprehensive care, physical therapy, and support for families. Now, you know, it's very easy for us to ask ourselves, what are the causes and, you know, the risk factors involved in all this? Now, the causes of neurodevelopmental disorders are multifaceted. This will involve genetic factors from, you know, the genes of the parents. It might involve environmental factors and epigenetic factors. And genetic mutations, you know, prenatal exposure to substances such as alcohol or, you know, drugs and complications during pregnancy and complications during pregnancy and birth time, all of these things can affect. Now, for example, if a parent, you know, a mother, pregnant woman, is exposed to alcohol during pregnancy or to smoking, and at times it's not even them who are smoking, but the fact that maybe they are constantly in rooms and places where persons smoke, and so they inhale a lot of that, you know, smoke and all that, that can affect. And, you know, the child, and by the time the child comes out during birth, they already have the condition. And so, and then, you know, or at times maybe conditions during birth where a child suffers asphyxia, loss of oxygen on the brain at that particular time, then we find that they are affected adversely and it leads to the condition. Or at times, even much later after birth, again, somebody can still be able to acquire due to one condition or another that leads to complications on our injury on the brain, developing brain, and the central nervous system, or at times either the brain or the central nervous system. And diagnosis typically involves a multidisciplinary approach, including assessment by pediatricians, clinicians, psychologists, and specialists in this area. And so it doesn't mean that because your child is exhibiting this condition, you just end up and say, okay, I tend to think my child has this particular condition. No, it is good for you to allow the child to see an expert, a medical expert, and let them do a clinical assessment to be able to know the exact condition that the child is having, and then be able to gain the therapies, early interventions that are available. So if you suspect that your child maybe has one of these symptoms that, you know, I'm talking about, and you suspect that the child could be having a problem, do not run into a conclusion in any way without having sought the, you know, expertise of a medical practitioner for assessment. That will really help, because evaluations may include observations, standardized tests, and medical histories to determine the presence and severity of the disorder. As I have said, we have others who are mildly affected, others are moderately affected, and there are others who are severely affected. So you need to be able to know how a person is affected so that then you see how to help. And treatment is also varied. We have medication, which may include like managing symptoms such as hyperactivity, you know, aggression or anxiety, or even pain in some conditions. We have therapies, clinical therapies. This may include like occupational therapy, physiotherapy, hydrotherapy, speech therapy. There are varied, you know, therapies that are available. You can also, you know, education in itself is also very there. we have special education services, adapted learning curriculums and programs, individualized educational plans, and all that for persons who have neurodevelopmental disorders. And apart from that, we also have the support services of the family, of the community as a whole, and even respite care, counseling and the like, because just like any other person, a child with neurodevelopmental disorders need to have and be assisted in a holistic manner. They need to feel loved, accepted, supported, accommodated, included. And this will include even counseling services as they transition from one state to another, as they go through grief just like any other person, as they face challenges, even to be able to understand the condition that they have, just like any other person. If you are diagnosed with one of these, huge quote-unquote conditions like cancer, like diabetes, you want counseling. That ideally also is for a child or a youth who gets diagnosed with these conditions. They are growing up and they realize, oh, okay, I'm different. But they need to be helped to understand the condition and how they can be able to maneuver and get to know that they're different. It doesn't mean that they are lesser human. They are actually able to navigate the conditions and live a fulfilled life like every other person. And so we have support and resources that are available for the children, for the families, for the caregivers, and for the entire ecosystem of persons who have neurodevelopmental disorders. And a comprehensive approach for families and for the caregivers and individuals with neurodevelopmental disorders for the support system will include professional guidance in this area, and this may include regular consultations from the experts, which will include probably healthcare providers, clinicians, and all that, educational specialists and the like. Another, way will be community support, and this will be support groups, advocacy organizations, and educational workshops where you are enlightened on what is available and how you can be able to access all the interventions and support systems and the resources that are available for you and for your loved one. And also online resources that we can tap, from. We have a lot of websites like this, CDC, Learn the Signs, Act Learn, and all that. And when you go to just Google, you are able to get from the websites and learn a lot of, information. We thank God for the availability. And so you can keep yourself aware of what is going on and learn a lot. And therefore, there is much more available for us to learn and to understand neurodevelopmental disorders, and know that neurodevelopmental disorders present significant challenges, but with appropriate challenges, appropriate interventions and support, individuals who have neurodevelopmental disorders can develop strategies to be able to cope with these conditions and lead fulfilling lives just like their non-disabled counterparts. Now, early detection and intervention are key to optimizing outcomes. And if you suspect that you are someone who have this condition, or you have your loved one who has this condition, there is somebody in your community or environment who has this condition, seeking early evaluation and guidance is crucial to being able to access the necessary resources and support and help this person to lead a fulfilling life. And we are happy to help you and work with you and to encourage you to know that having a neurodevelopmental disorder is not the end of the road. Speak life. Speak positivity, speak hope into the life of an individual who has a neurodevelopmental disorder. Thank you for listening in to Boom Trust Podcast, Beauty Out of Mire. We all belong to something beautiful. And here we speak positivity, acceptance, and inclusion. Keep tuned in for more stories of resilience and hope.